Good afternoon, everyone, and thank you very much for joining us here today. Just last week, we were talking about how the pace of our vaccination program was off to more of a sluggish start than we had hoped, and more of a sluggish start than it should have been. Since then, we have seen a dramatic improvement in the rate of vaccinations in Saskatchewan. That is thanks to some policy changes, as well as thanks to the efforts of our healthcare workers who are administering vaccinations throughout the province. In the past week, we've administered vaccines in long-term care facilities in a number of communities throughout the province, and to many other people aged 70 and over in those very same communities. As a result, we were able to deliver about 15,000 vaccination shots this past week. In fact, on a per capita basis, Saskatchewan has now delivered the second highest number of shots of any province. We're behind only Prince Edward Island, which has obviously a very small population. In fact, if Saskatchewan was a country, our pace of vaccines delivered would now be in the top 10 among all countries worldwide. So that is very good news. And we will continue to deliver vaccines as safely and as quickly and as efficiently as possible, just as soon as we are able to receive them from the federal government. Unfortunately, we are now expecting a slowdown of vaccine shipments from Pfizer over the course of the next 4 weeks. For example, this coming week that we're in, we are expecting only 2,925 more Pfizer vaccines. Those doses will be delivered to Regina, to Fort Qu'Appelle, and to North Battleford, where they will be administered to residents and staff in long-term care as well as personal care homes. At the pace we are going, and with a slowdown in deliveries from Pfizer, we expect that Saskatchewan will run out of vaccines over the course of the next few days. Over the next 4 weeks, we are now expecting about 17,500 doses from Pfizer, and that is rather than the 37,000 doses that we were expecting to receive. We did almost that many shots this past week alone. And just this morning, Major General Fortin said Canada is now expecting no deliveries from Pfizer next week. So we are in the process of seeking clarification if that will further impact Saskatchewan's total supply of vaccines over the course of the next 4 weeks. But this much is clear. We will need to revise our vaccine rollout plan in the coming weeks because of this latest delay, and we need the federal government to pick up the pace of vaccine deliveries in the weeks ahead and pick up the pace of their negotiations and discussions with Pfizer in particular. Life will get back to normal when we have a significant portion of our Saskatchewan population vaccinated, but we do need access to more vaccines in these early days. I would encourage everyone to sign up to get vaccinated as soon as it is your turn, and to continue, in the meantime, to follow all the public health orders and the guidelines that are in place. We will get through this as we get more of our population vaccinated, yes, but until then, I'm asking everyone to keep following all of these public health orders that are in place. Keep yourselves safe, keep those around you safe, and keep your families safe. Thank you, and Dr. Shahab.
Thank you, Premier. So, first of all, I'll start by offering my condolences to those who have passed away since we last were here, and that is 19 people who've passed away due to COVID-19. And again, a reminder for all of us that, this is ultimately why all of us have to do what we need to do to keep our hospitalizations, ICU admissions down, and of course to keep as low as possible deaths due to COVID-19. In terms of our case numbers, our daily new case numbers have decreased from 321 to 307-day average, down from 26.5 to 100,000 to 24.7. So not a marked decrease, but certainly a trend in the right direction. Our active case numbers have increased from 3,200 to 4,000, but around that, I think we have seen some issues with reconciling active cases. Most active cases should remain active only for 10 days, but we've had some cases who have been remained open well beyond 21 days, and that's artificially inflated our active case numbers. So that will need to be adjusted. But having said that, we have to remember that even after adjustment, it's likely that our daily 7-day average and our active case currently will remain the highest in Canada. And I think that is something that we need to be very concerned about. Going back to our case numbers, our daily active case rate, as I said, increased from 271 to 333. Our test positivity in Saskatchewan has decreased from 12.3% to 10.3%. So again, a slight trend in the right direction. And also very important, our daily testing rate in Saskatchewan has increased from 220 per 100,000 to 242. So again, this is really important. We want to see a decrease in our 7-day average case numbers. In our daily cases, we want to obviously see a decrease in active cases. That really is basically a 10-day average for the most part, because you come in on one end, you exit on the other end, and most people exit after 10 days. And if you're hospitalized, you should remain active up to 21 days, even though you may be in hospital for weeks or months. And our testing rate should remain high, because apart from staying home if you're sick, staying home as much as possible otherwise also, reducing social interactions. We discussed a number of contacts has come down to between 3 to 4, which is very important. It's really important that we seek testing even if we have slight symptoms. That way we can isolate for the 10 days, and we can make sure our close contacts also isolate, because that is really important to break the chains of transmission. And then we continue to have active assessments on what additional public health measures may be required if our case numbers remain high or keep trending up. But I want to say clearly that our current measures, if they are complied with by universally, they are sufficient to bring case numbers down. We saw that happening very dramatically in the middle of December, and even now, whenever we see transmission, it's almost always lack of compliance with current measures. All of us have seen videos and pictures of situations in bars. No compliance with public health measures is evident in those videos and pictures. Similarly, we have unfortunately had outbreaks in funerals and wakes, where even though up to 30 people can attend a funeral or wake, you still have to practice physical distancing. And when concurrent groups of 30 are attending to pay respects, that does sometimes lead to significant transmission. And again, my recommendation is that try to pay your respects as much as possible virtually in this time and age. And if close family and friends have to pay their respects in person, follow all those precautions. At times of emotion, whether it's a wedding or a funeral, even with limited numbers, when people become overcome with emotion, that hugging and getting closer than 2 meters, that does unfortunately result in transmission, and in many cases, hospitalization and death, further to the event where everyone was going to pay their respects. And these measures, we need to stay the course over the winter or the spring till we get into the summer, because by then vaccinations would have been available to the vast majority of the population. But till such time, we really do need to stay the course with our current measures. And we obviously need to do all this to keep our case numbers down, but also to protect those who are most vulnerable and still have not been vaccinated. So people who are our friends, family, parents, grandparents, who have underlying health conditions, for example, they are the most vulnerable, who need to be protected by all of us practicing all these measures all the time. Thank you.
Thank you, Premier. Dr. Shahab, we will now take questions beginning in the room. We'll start with Arthur.
This is first for the doctor. You're talking about the need to stay the course now, whereas last week you were talking about the possibility of bringing the hammer down. And I'm wondering, you're talking about cases going in the right direction, but are they going in the right direction quickly enough that you feel that you may not have to bring down that hammer? And a related question for the Premier, it's now about a week that we've had the highest active case rate in the country. How is that not a sign to you that we need to do more?
I'll go first. Yeah, I think that's exactly the dilemma that we are facing. I have regular discussions with Mr. Merriman, and it is a difficult situation because we continue to be stuck in this 300 range. And, like I said before, we want to be heading down below 250, below 200, below 150. That's where we need to go. And mid-December, we were heading in that direction. Over the holidays, we really went down, but that is artifactual because testing numbers went down. Then first 2 weeks of January, we saw clear signals from the few who did not comply with the guidelines and gathered over Christmas. There's a clear bump. And then we thought, okay, will we get over that? We saw cases 300, 400. Now we're not seeing that signal so much, But we are seeing examples where people aren't complying with the current guidance, and it seems to be mostly younger people or in situations where people feel compelled to go because of the death of a loved one, and we are seeing transmission there. And like we discussed, because our baseline transmission is so high, 300 cases a day, 2% of people at any time are sharing COVID, because there are things that you could have done in August, September, October. Now you can't do, because the likelihood of transmission, even in small gatherings of 30, which are allowed for a funeral, if you have 3 of such gatherings, in one there's going to be transmission, 1 in 3. And so again, that's the dilemma, and I think we need to be very cautious of any gatherings, pay our respects virtually as much as possible, and the current guidance allows for close family and friends to get together for those occasions. But overall, I think we need to be very cautious. And I think if this current trend continues, 300 plus cases, we can see that our hospitalizations and acute care and ICU are creeping up. They aren't going up very quickly, but they are creeping up. So over time, I think that creates its own pressures on the healthcare system, and unfortunately, it generates unfortunately deaths as well.
So on the follow-up question with respect to the active cases and where they have been in relation to other provinces over the course of the past week, I think Dr. Shahab has talked about some of the lag that we have had in our active caseload and some of those numbers falling off. And you'll see that over the course of the coming days and this week, and it's alluded to in today's press conference. That being said, we continue to have a number of new cases each and every day. And I was looking at our 7-day rolling average over the course of the last couple of months here. And I would maybe just start this with the measures that we have in place are not insignificant. They're very significant measures, and they did prove to be successful throughout the month of December. If you go back to December the 12th, which I believe was the day that we enacted the bulk of the measures that Saskatchewan now has, we were just under 300 cases a day, about 288 cases a day. We peaked in the time after the holiday bump, which we had predicted would likely occur, at about 320 cases per day on the 7-day rolling average, and we're down now to about 300. So we need to continue that downward trajectory, but most certainly I think it's fair to say that our cases here in the province on the 7-day rolling average are beginning to stabilize, and it will be watched very closely in the days ahead as we extended those measures for 2 weeks out to the end of the month in anticipation that they would be successful in these days as they were throughout the days during December, notwithstanding the holiday bump that we had. So, very positive on where we're going. Do we need to see these numbers bend down further? Yes, absolutely.
Follow up, Arthur?
I just wanted to know, and I think this is best posed to the doctor, the delay in the further Pfizer shipments and the fact that we may get none at all on the week of the 25th. What is that going to mean for people who got their first dose, say 3 or 4 weeks ago? Are you concerned that you may have to extend the gap, and is there any fear that might impact vaccination efforts?
Yeah. So I'll make a few comments, and then Mr. Scott Livingstone may need to add to that. But there's a few things there. One is that we knew that we were going to get very limited shipments, but we knew that they would come at predetermined times, so that let us plan for first doses and when second doses were due for second doses as well. And in many cases, second doses have already been given. Obviously, when there's a sudden further disruption, that does present challenges for both first doses for people who we were planning to, but also completion of second doses. Now, on a positive note, the National Advisory Committee of Immunization and many other international experts have confirmed that the second dose can be given at any time up to 42 days. So that's very reassuring. And the Council of Chief Medical Health Officers has reaffirmed that by a statement as well. So most provinces are able to give the second dose of either Pfizer or Moderna within 42 days. And so that will be adjusted on the operational planning, which was needed to be done in any case, but that becomes also very important with the disruption shipment. So I'll ask Scott to maybe describe in more detail that the shipments that are coming, will they go more towards completing second dose or continuing to give first doses, or a combination of the two?
Thanks, Dr. Shahab. So it is the latter. It is a combination of both, looking at how we do more first doses as well as continue the second doses. Just reminding, with the 42-day time period now for the second dose, it does mitigate some of the decrease in doses coming. And we also know through contact with the federal government that once the Pfizer plant is back online, they'll be producing numbers and increasing our shipments accordingly. But however, our immunization team is trying to be as nimble as possible, knowing that we could, at any time through the pandemic receive more vaccine, but also, as we've seen today and last week, less, and having to readjust our targets, but still focusing on the most needy in this phase one. And we will continue to do that as vaccine supply starts coming back up.
We'll take another question in the room. Mark?
Yes, we heard from residents of Capel House here in Regina today that were being vaccinated yesterday. There was a limited amount of vaccines available, and they drew names out of a hat to decide which residents received the vaccine. Why was there not a better plan in place to lay out who was going to get vaccinated or have enough for all the residents at that facility?
Scott, would you have any insight on that specifically? I'll maybe just a couple of comments previous to that. I can't speak to that particular facility and what vaccines were allocated, but I would say that your comment about not having enough vaccines is true in every community. We do not have enough vaccines to vaccinate everyone at this point in time. That is in part due to the difficulty in procuring vaccines in these early days that Canada seems to have had, and then in part due to first the reduction in vaccines that we were told about a number of days ago from the Pfizer interruption in their European manufacturing facility, and then this morning learning on the news that actually the province's allocation or Pfizer's allocation next week is going to be zero, not just reduced, but ultimately reduced down to zero. So we've communicated with the federal government. We'll continue to communicate that there's two things to do here. One is for the provinces to administer the vaccines that we receive. We've gotten that up to 2,000 to 3,000 vaccines per day, 15,000 this past week, and have the capacity to go beyond that. The second piece that's critical is the federal government in controlling not only the supply of vaccines and procuring the vaccines for Canadians in all provinces and territories, but also ultimately having, in addition to that reliable supply of vaccines, having a reliable supply of the information on when and where we are going to receive those vaccines. So it's pretty concerning this morning when we learned via newscast that we may have a shipment of zero next week. And so we are reaching out to determine exactly what that means for Saskatchewan, as we learned alongside everyone else, and ensuring that we can adapt and adjust our vaccination program accordingly. So I can't speak to the individual incident in one location in the province, but I can say that we are short of vaccines at every location that we are providing vaccines in Saskatchewan. But I can assure Saskatchewan residents that as we receive them from the federal government and our suppliers, we most certainly will make them available to everyone. Scott, do you have anything to add on the specifics of the one location?
I do, Premier. So, Mark, again, we recognize, as the Premier has pointed out, that everyone is anxious to receive the vaccine as quickly as possible. And certainly with respect to this situation, we're going to review it in detail to understand what happened. But as I understand it, as you know, our focus of the immunization program is the high priority groups on the list, which include starting with our long-term care residents, personal care home residents, and staff in our and some of our other most vulnerable patients. As I understand it, the other thing to bring up is that the Premier just focuses. We weren't getting what we expected for vaccines with a lower shipment of the vaccines. So when we went into the facility, as I understand it, started on a long-term care side. Our nurses ended up getting some extra doses, and on the assisted living side, which would not have been expecting to receive doses because they weren't in that. They're not in that initial priority group, but they are within phase one. there was a decision made on site to administer a small amount of remaining doses to some of the residents, but not all on the assisted living side. So it's it was the staff thinking on the ground because of some of the restrictions with the frozen vaccine. We can't take it back with the Pfizer product, and we didn't want to waste it. The 6 individuals that did receive it on the assisted living side are in that phase 1 group. They just weren't in the group that was intended to be vaccinated that day. And like I said, our teams are doing what they can to get vaccine in the arms of our most vulnerable as quickly as possible. The logistics and some of the limitations of how the vaccine can be transported once it's stored limits, and that's really what's happened in this situation. But as I said, we'll be reviewing this one and others as we learn more about how to best immunize people as quickly as possible and modify our program as such.
Follow-up?
The vaccination clinics that are being set up, many seniors don't use technology like cell phones or social media to find out about them. How is the government ensuring that all seniors that are scheduled to get the vaccine can have access to that information about how and when they can get it?
Scott, do you want to answer to the logistics of
Sure.
the scheduling?
Sure. So with respect to the start, Mark, the biggest scheduling challenges has actually been the staff, not patients, because with the patients in this first phase in the communities, we've been using some of the infrastructure we use normally for immunization in our flu clinics, particularly leveraging long-term care, personal care homes, as well as other types of facilities where you have a number of seniors living in a single facility. Now, going forward, as we plan for expanded clinics, we'll be using PSAs when we get into the 70-plus later in phase 1, and we are looking at multiple ways of having the ability to contact, whether that's through social media, through newspapers, through radio advertisements, direct telephone calls to patients that are viewed as eligible to receive the vaccine. And we're also looking at but in the process of implementing an online scheduling system, not just to support, mostly to support phase 2 where we receive much larger vaccine, but we're trying to approach this in a multifactorial way. And again, we're still learning. The transport of a small amount of vaccine into communities does give us opportunities to go a little farther on some occasions instead of sending that back where there's risk of wasting the vaccine. But as vaccine deliveries come online and we see the numbers that we want to see, which is large numbers of vaccines available with multiple clinics across the province, we'll be using multiple mechanisms to contact those eligible to receive the vaccine in their communities.
We'll take our next question on the line. Operator?
We have Roberta Bell with Global.
My question relates to Capel House as well.
I think we lost you, Roberta. Roberta, are you still there?
Operator, do we have someone else on the line? We'll move on in the room. Steph?
Mr. Premier, if we, as the doctor said, we need universal compliance on all the public health measures to make them work, and the outbreaks we are seeing is because people aren't following those public health measures in bars or funerals, why don't we take those activities away and bring down more restrictions to get us unstuck from this current high caseload we're in?
So I would say that, let's use the example of restaurants and bars, for example, and I'm sure many saw the video this past weekend of patrons in a bar or restaurant here in Regina where they were, evidently and flagrantly outside of what the public health orders recommend, and most certainly outside of what the public health laws allow for. But the vast majority of our restaurants in this province are adhering to the public health orders that are in place. But there are these few outliers that are not. And let's just put this in perspective as to Dr. Shahab's comments about how we do need everyone to adhere to the public health recommendations that are in place so that we can get back to some degree of normal. I have sitting on my desk right now a petition with over 10,000 signatures on it. Signatures from parents, from adults that are asking for us to allow their children to play hockey or to play have the opportunity for competitive youth recreation. I hear about that from my nephews when I go home back to Shelbrooke. I talked last night to a parent that was speaking quite passionately to the challenges that he sees, not only from a physical perspective with his child that isn't able to compete this year, but the mental health challenges that him and his friends and his teammates are going through as well. And at the very same time as we have these adults asking for their children to participate in a sport like hockey, we see a video of a number of adults that are selfishly and drunkenly dancing around a restaurant or a bar right here in Regina. So, the question I ask myself is, do we need to punish all of the restaurants, many that are adhering to the public health orders that are in place, because there are these few that are not? And I would say, no, we don't. We don't need to publish or punish all of those that are following the public health orders. But to those establishments and even those individuals that are flagrantly operating outside of what the public health orders are, they do need to be punished. And I've asked public health to look at, is there other opportunities in addition to fines, including closing these bad actors indefinitely, to ensure that we are having compliance in our communities, are having the compliance and allowing that opportunity for many of the ones that are following the public health advice to continue to operate and to operate safely. I don't believe that we need new measures put in place to bend the COVID curve here in Saskatchewan. What we need is everyone to follow the measures that are in place, and enough is enough. It's time for us to start enforcing those that are not following those measures. We have kids in community after community across this province that are making the sacrifice. It's time for all of us as adults to make the same sacrifice.
Follow-up?
When are we going to see enforcement step up then? Because everything I'm hearing from both of you is that the urgency is there now, and if you need universal compliance, it's a pretty that's a pretty lofty ideal we're going for as we all experience COVID fatigue. So when are we going to see tougher enforcement?
Enforcement is occurring as we speak. There's often, and there is ongoing public health investigations that are occurring with, I believe, the establishment that we're discussing, as well as a few others of recent, and the financial penalties have been administered, will be continued to be administered. But I have asked public health, as well as I would encourage law enforcement, when people are flagrantly in violation of the public health orders, whether it be an individual or in particular whether it be an establishment that is putting their staff, their employees, as well as their patrons at risk of contracting COVID, to not hesitate, to enforce the public health orders as they are in place. And that includes our restaurants and our bars that are not adhering to the public health orders that are in place. There has been enforcement. There's going to be continued enforcement, and I encourage our law enforcement and public health to escalate the enforcement that they've had. And I've also asked public health to look at, is there additional measures that we can put in place, up to and including closing these facilities that are refusing to follow the public health guidelines and laws that are in place. We're not going to punish everyone for the actions of a few.
We'll take our next question from the line. Operator?
We have Lara Fominov with 650 CKOM.
Hi, Premier Moe and Dr. Shahab. Premier Moe, you were saying enough is enough just a few moments ago. I'd like to know why, if there are establishments like bars, restaurants, and other businesses that are defying public health orders and who are being fined, why are they not being named? What's the difference between somebody being charged with a crime and being able to find out their name and not being able to find out the names of the businesses that are not abiding by public health orders and are getting those fines?
I think many of them are being named. We've heard the name of Crackers, the Tap. We've heard a number of these names being reported in the media. Scott, maybe you can speak to the specifics with respect to how those names are being disseminated. But we've heard a number of them that have been named via social media and other methods. But rest assured, as public health is aware of these, they are being investigated. The fines are in place, and we are looking at added measures that we may avail ourselves to in the days ahead, including closure.
A follow-up question, please. With all due respect, though, Mr. Premier, these establishments are not being named by the provincial government or by the Health Ministry or by the SHA. We've asked time and time again for names of businesses that have been fined and have been told it's a privacy issue. And as far as I'm aware, businesses don't have the same expectation of privacy that individuals do. So again, why are they not named? Why do those names have to come out on social media, or only if there's an outbreak?
There are, and Scott, I'll ask you to follow up on the privacy issue. There are a number of names of individual businesses that have been named with respect to the PSAs that have been put out to protect the public in the lead up. I'm not certain, and Scott, maybe you could enlighten on when there are fines that are administered, are the names of those establishments actually released? Or maybe you, Doctor.
So I would ask Dr. Shahab to probably kick in on this, but I'm not sure. We do not normally release the names, although the names would be, of course, on the tickets themselves. And it has been our experience so far during the pandemic that most come out in social media before we release, or even, in fact, as you know, in the case of Crackers in Saskatoon, well before we even finish the outbreak investigation, defining what the scope of the outbreak is.
Do you have anything to add, Doctor?
I think what I'll say is, I think there are two aspects of that. One is that obviously when there's a need to announce a venue where we couldn't trace all the people, all the customers who came, obviously in that case an outbreak is named and the public is told to contact public health if they went to this venue on this and this day. Obviously for workplaces which are not public facing, or private residences where there was a gathering that is not allowed, when fines are issued, those settings are not named in person, but as an aggregate, we're all aware of fines that are issued for in private residences or workplaces, and similarly public-facing establishments. But I think it's a good point that at least, at the very least, we should identify the types of facilities by, is it a licensed establishment, is some other setting, just to get better awareness of where are some of the guidelines not being followed. So I think we'll have to do some follow-up on what we can legally disclose or not.
And there will be some additional follow-up on these establishments that are refusing to follow the public health orders that are in place. And to your question, there has been a few of them. Should we be looking at additional measures up to and including closure for indefinitely or for a period of time? Enough is enough, as I said. It's time for all of us as adults to do what our kids are doing and to adhere to the public health advice that is here to push these numbers down, to ensure that we have access to our vaccines so that we can return to some degree of normal life here in the province in the months ahead.
One other thing I'd like to add is that, and I've said this last time as well, that there's three possibilities. One is that the business owner was deliberately not complying with the guidelines, and those situations do happen, where really the onus is on the business owner. The second is, both the business owner and patrons are not complying, and there's a kind of a trend or a culture in some venues to repeatedly be not as stringent with the rules. And then again, I think the responsibility is on both patrons and business owners. In some cases, unfortunately, the business owners are trying their very best to comply with the guidelines, but the patrons are not complying and creating problems for the business and for other patrons there. So sometimes, what's actually happening does take some time to investigate as well.
We'll go back to the room. Adam?
Can either Dr. Shahab or Mr. Livingstone explain how we're deciding where the phase 1 vaccine goes, what communities it goes to, and who gets it? Because I think that's a big question from the public right now, and for people that are over 70. How are we deciding what's the criteria of where we're going and when?
So maybe I'll make some initial comments and ask Mr. Livingstone to add. So obviously we already know January, February, very restricted amounts. And the priority in these 2 months is residents of long-term care facilities, staff, and also specific healthcare providers who primarily providing care to COVID-positive patients. Not, all healthcare workers are getting the vaccine in the first phase. Obviously, the shipments are coming in small amounts. So if it's Moderna, it goes to the far north rural areas. Like if it's Pfizer, that's going to the larger hubs and then secondary distribution. The initial allocation was also based on where transmission rates were higher. So initially, vaccine came Regina, Saskatoon in December as part of the pilot, but then it's been going to PA, for example, because transmission rates were higher there, and of course Moderna to the far north because of high transmission, but then also now to the southeast because of high transmission and secondary rural area. So those are the general principles for allocation, and I'll ask Scott if you'd like to add to that.
So So just to reiterate what Dr. Shahab has essentially already said, Adam, our focus is long-term care, primary care residents, personal care home residents, and staff. Also First Nations communities across the province, and particularly as well as seniors over the age of 70. There are some other things that factor in, and we've talked a lot about the logistics of the vaccine and where we can ship the Pfizer vaccine safely, as well as using the Moderna in farther out regions, because it's a lot less sensitive to temperature breaks, and also it allows us to get it out in other communities. So that has been the focus of the entire program rolling out. With respect to what's happening next and where we go, it's really dependent upon the supply. And as you know, over the last couple of weeks, we've seen supply changes, and we've been running numbers and reestablishing priorities for communities and trying to go as far as we can in long-term care, and then moving into personal care or private personal care homes as quickly as we can. But also understanding when we go out with an unfrozen product to administer, if we have vaccine left, we would go deeper into some of those priority populations in phase 1, but not going beyond. So we are sticking to the phase 1, but it can be a little different based on the community we are going to. And as Dr. Shahab has already reiterated, one of the other big factors in the distribution is the attack rates or the current caseloads in those areas of the province, which also have a high likelihood for us to be successful in vaccinating folks and dealing with the most vulnerable, where we have high attack rates.
Do you have a follow-up, Adam?
You heard the Premier today say that you're not looking at other restrictions, you don't want to do that. There must be a number or some kind of indicator for both of you that says, okay, this is point of no return, we can't handle this hospitalization-wise, whatever it is, number of test positivity rate. What is that indicator for people to know that if we don't hit this, we don't all band together to knock this number down, then there is going to have to be something that neither of you want to do. Is that, have you had a discussion about that? Is that a possibility? What is that number? What is that indicator?
Yeah, I'll make a few comments, and then Premier and Mr. Livingstone may want to add to that. But from my perspective, obviously, we want to see numbers as low as possible, but we also want to focus on, based on current guidance, what are some of the problematic areas. So I already mentioned some of the problematic areas are specific bars. Unfortunately, when people with the best of intentions overcome with emotion, attend funerals or other gatherings. And then we've also recognized that, we are allowed to gather outdoors in groups of 10. And we've all seen how they are obviously safe. We've seen people are physically distanced and they're fine. But we've heard in some situations throughout the province, but especially where the attack rates are highest, far north, where younger people may be gathering outdoors, but they're getting closer together. They may be gathering over food and drink. And by being close, even though the outdoors transmission is happening. So I think those are sectors that I think are important right now. If we get compliance with these in these areas and compliance by everyone, I think that can dramatically bring our numbers down. The second thing is that our case numbers are not high throughout the province. Case numbers are fairly low in the central west part of the province, southwest, south central part of the province. If you remember last fall, that's where the cases were highest. So again, one has to recognize that several parts of the province there seems to be high compliance, and that's great. And they are the example for all of us to follow. And then, of course, sometimes our case numbers go high because we have these devastating outbreaks in long-term care facilities, other congregate living facilities, and that just affects the case numbers for that part of the province, just because you have such a high outbreak, and that impacts hospitalizations. That's one point. And then the second point, obviously, is that obviously our hospitalizations and ICU admissions are trending up, and we know that in many other parts of Canada and many states in the U.S., that has been the limiting factor, that when your hospital just can't keep up, when you have to make a decision between who gets treatment and who doesn't, of course, that's a point of no return where you have to bring the hammer down to save the health system. We may not be there yet, but I think that's what was mentioned, that the hammer is a very blunt instrument. It causes many unintended consequences. It's not the preferred instrument, but when the health system is on the brink of collapse, then unfortunately those desperate measures have to be taken as well.
Scott, do you have anything to add?
I don't. Dr. Shahab covered it.
And I would just reiterate in many ways what Dr. Shahab has said. The active case count is one metric that I think everyone is watching, including Dr. Shahab and myself. But you're going to see the active case count fluctuate a fair amount over the course of the next few days here in Saskatchewan, and the active case count per 100,000. In fact, you'll probably see it in Saskatchewan go under 200 people per 100,000, which still is too high for our province, most certainly. The number I think that everyone watches as well is the number of fatalities, and every fatality due to COVID or any other reason is tragic for the family and the community where that individual resides, and for the province. But we have fared fairly well with respect to and relative to other provinces, and we're below the national average when it comes to the number of fatalities due to COVID-19, and a credit to our long-term care staff in this province that have done a very good job at ensuring that COVID-19 has not entered, and where it has entered has been controlled fairly well in our long-term care facilities, and we're all aware of the results when that does occur. But the hospitalizations, we have said since day one that we will manage appropriately to ensure that our hospital system is able to handle what, and I think in the early days I used the term what is coming at it with respect to COVID-19 infections. I believe today just Manitoba has placed a similar size, has about 50% more of the hospitalizations roughly than what we have here in Saskatchewan. In saying that, our hospitalizations in this province have been creeping up, and they're heading in the wrong direction, however, albeit slowly. And so I'm sure Dr. Shahab, I know Dr. Shahab is watching the hospitalizations in this province as well. That being said, we're very positive on the fact that the measures, as I've said many times, that we have in this province are not insignificant. We have kids, as I said, that aren't playing competitive sports. We have many businesses that are curtailed in the way that they are operating, most certainly, and the measures did prove to be successful throughout the month of December up to and heading into the holiday season. We have seen a bump since then, but we are more recently seeing the numbers starting to stabilize here in Saskatchewan and take the very first steps on a trajectory downwards. So the measures that we have been successful before. We're ambitiously looking for them to be successful in the days ahead to prevent any further increase in our hospitalizations, because that ultimately is the number that I think everybody is watching, and I don't know if it's a specific number as to when things would change, but that is a number that everybody's watching, and the fact that they are creeping up and the fact that we are seeing videos like we saw this past weekend do make us pause to ask ourselves the question as to, do we have the right measures in place? Yes, I believe we do. Do we need to now ensure that the measures that are in place are adequately being enforced, and those bad actors that are not enforcing the public health measures, or those individuals that are not adhering to the public health measures are going to realize what the full consequences of the punishments are?
We will take our final question on the line. Operator?
We have Brian Zinchuk with Glacier Media.
Hi there. I'm curious here, and maybe this question is a few months early, but we will, at least in some of the areas where you've been doing the long-term care centers with all the staff and all the patients, once they've had their booster and effectively 100% of the people in and out of that building have been immunized, and that immunization has taken place, are we going to start seeing some restrictions for those people lifted, or they're going to have to wait 6 months until everyone's been immunized, or what's the plan of that?
Yeah, I think that's a really important point, and right now we have to be very cautious because the vaccination rate is coming up very slowly, and as you know, in the clinical trials, the vaccines had 95% effectiveness, but in the real world, we do know that if you're elderly, have immune suppression, the vaccine may not be that effective, and so COVID is so highly transmissible that even if you have a long-term care facility where you, for example, have a 90% uptake of the vaccine, and the vaccine is 90% effective, that still leaves 20%, a significant proportion of the long-term care residents still susceptible to COVID. So I think at the present time, it is very important that as our vaccination picks up, we adhere to all public health measures. Once we have the vast majority of the population vaccinated, especially adults with underlying risk factors, but also broadly all adults, I think then we can cautiously start looking at how we relax our public health measures over the summer. Likely that will start happening. And again, I think it remains important that right now, obviously, there's low vaccine amount, high demand, especially from the most vulnerable. I think once we have large amounts of vaccine available in the summer, we need to make sure that those of us who, if COVID rates are even low in the summer, all of us think of getting vaccinated, because that is one way how we can, come out of most restrictions that we currently face by fall. But I think right now we really have to, even after getting vaccinated, we do have to comply with healthcare, all public health measures, because not everyone is fully protected by the vaccine, and we're understanding more about how the immunization affects not just clinical illness, which it does protect to a large extent, but also transmissibility. But as we get more data from Canada, from our own province, and from other countries, we'll be updating guidelines on that, but that likely won't change till at least May, June, once we have the majority of the population, especially the most vulnerable, fully immunized. Thank you.
Brian, that's a good question, and it ties into our last question about hospitalizations as well. And you're right; you're probably a couple months early with that question. But the fact of the matter is as we are able to access vaccines for the most vulnerable in our population, the elderly in our population, and start creeping those vaccines and the availability of those vaccines down through the age groups in society, it does beg the question on when will we be able to start to look at relaxing the measures that we have in place, the very significant measures that we have in place here in Saskatchewan. And I would point back to the conversation we had about hospitalizations, and as we start to hopefully, and if you look at our hospitalizations, they're quite often the age of the folks in hospital are somewhat younger than what we might have in our long-term care facilities. And so as we work our way through the age groups and we start to see our hospitalizations decreasing in significant fashion, that would speak to the fact that we have many of those that are more vulnerable in our community receiving the vaccine and not contracting COVID-19. And that is a point, I think, when we could have a little more open conversation about what the future looks like for Saskatchewan. So two things on that. That isn't in the next number of weeks. That will be in the next number of months. And this speaks to the importance of us as Canadians and us looking to our Canadian government to do everything they can to procure as many vaccines as they can, and to do so in as the shortest time frame as possible. I think Premier Ford had made some comments today about what he would urge the Prime Minister to do, and that was to find, I believe, someone, if not the CEO of Pfizer, and maybe light a firecracker up his yin-yang, I think was the words that I heard. And I would just say that there would be a lineup of premiers behind. If the Prime Minister was able to do that, there would be a lineup of premiers behind that would bring a lighter to that party.
Follow-up, Brian?
I've been asking for months here about comparing us in Manitoba and North Dakota. And North Dakota has brought its daily numbers down to the point where they're actually fewer than Saskatchewan, where a few months ago they had as many as 1,500 to 2,000 new cases per day. And apparently on Monday, North Dakota released its statewide mask mandates. Now, local jurisdictions can still enforce that, schools can, but I mean, do you think they might, first of all, what are they doing that they're doing right after having not done so well to bring it down to below where we are? And number two, do you think they're jumping the gun on releasing the mask mandate?
So, I avoid commenting on other provinces and certainly on other states. But, I have been following North Dakota, and I agree that it's a province, fairly large like Saskatchewan, fairly rural, about 750,000 people, and they were in dire straits end of October, November, some of the highest case rates and highest hospitalization rates, tremendous pressure on the health system. And yes, they did introduce mask mandates initially at county and at level, and then at a state level, and certainly, but that's the lesson that, when there's high compliance with all the public health measures, things change very quickly. And I think that's the main lesson from North Dakota. But also we've seen that in Saskatchewan. We've seen that in our neighboring provinces. High compliance through public health measures, restrictions, but also then high compliance by all of us dramatically changes the course of the pandemic. So that's what you saw in mid-December. That's what we really want to see right now. That, we have all the advantages in Saskatchewan. We have a large geography. Even our indoor places, whether it's retail or other settings, they are huge compared to many indoor places in Europe, for example. And we need to take full advantage. The mild weather, when we can be outdoors, we really need to capitalize on all our advantages and really comply with the guidelines and bring our numbers down. And if all of us start complying today, and I can guarantee you'll see our numbers come down dramatically within a week.
I would just add to that in North Dakota, I know they implemented a number of measures. I can't remember the date, but it was a few months ago, and apparently they have been effective. There's been obviously mass adherence to the measures that Governor Burgum had put in place. I've talked to Governor Burgum a number of times throughout this pandemic with respect to some of the challenges that we've seen on north end and south of the border. And their numbers have come down markedly, and that is through people doing the right thing and taking their individual responsibility very, very seriously. I would add to that, and the last I checked, and they're likely north of this number now, but the last I checked, North Dakota was in excess of 5% of its population that had been vaccinated. In fact, I think it's a few months ago we were talking about North Dakota having the highest per capita rate of COVID infections in North America. I believe if they're not leading North America now on the vaccination rate, they're very close to it. And so they have had a very robust, ambitious, and aggressive vaccination program. I know one day they had over 300 vaccination sites operating in North Dakota. So they've been very ambitious with respect to procuring vaccines and making them available to North Dakotans. And I think that speaks to the importance of us having access to a large number of vaccines as soon as possible, ultimately finding our way through this COVID-19 pandemic and finding our way back to some degree of normal in our communities.
And that is all the time we have for today. Thank you for joining us.